हाँ तुषार, कैन यू हियर मी? तुषार, आपकी आवाज नहीं आ रही। तुषार, यू आर म्यूटेड। तुषार, आपको मेरी आवाज आ रही है?
यस यस यस, अभी मेरी आवाज आ रही सर।
या परफेक्ट परफेक्ट परफेक्ट। आई थिंक
शुड आई
तुषार,
स्टार्ट सर?
like,
यस यस प्लीज सर।
yeah, I would say this is a very responsible work on which we are talking today. So I hereby present, my associate professor from Department of Pharmacology, Dr. Tushar Vaiti. He'll be talking on a very important topic that is pharmacovigilance and ADR reporting. Dr. Tushar, may I request you to please start?
यस, थैंक यू सर फॉर दैट काइंड इंट्रोडक्शन एंड माय स्लाइड्स आर विजिबल सर.
Yes.
Okay. So, a very good evening to all of you. And today we are going to talk on a very important as well as interesting topic, that is pharmacovigilance and ADR reporting. So, the Department of Pharmacology has already conducted the GCP workshop where we have briefed all the residents as well as faculties about the clinical trial. This is something a second aspect of pharmacology where we are going to focus, that is pharmacovigilance. See, the word itself suggests that vigilance means observation and pharmacon means a drug. So we have to be observant about the drug. But for what? For its safety purpose. Safety purpose or for the adverse drug aspects. Okay. So apart from efficacy, it is equally important for the physicians as well as the all who are involved in the drug development process to focus on a safety aspect. Okay. And there are, if some certain adverse drug reactions which are observed, then it is our moral duty to report that adverse drug reaction to the regulatory authority or to the proper authorities which are involved in this process. And that is the my today's session, that where we are going to report this. So today I'm going to talk on adverse drug reaction and adverse drug event. Then which are the types of adverse drug reaction? What is the need of this pharmacovigilance? Then pharmacovigilance program of India. Then we are going to see how the ADR reporting form is there and how to fill that ADR reporting form with example. So all drugs may be safe, all doctors may be right, but we are not here to talk about the safe drug, but safe use of a drug. If you look in history, the drug not known is like a poison. जिसके बारे में आपको पता नहीं है, we can see that it is like a poison unless and until we explore the entire aspects of that drug, including the safety as well as efficacy. And drug improperly given is also like a poison, which is written in Charak Samhita. So today we are going to see about the adverse effects. So adverse effects like a thorns. So if we want a rose flower, then we have to very precautious about these thorns. So just like we want the good effects or therapeutic benefits from the drug, we have to take care of these adverse effects which are inseparable from the drug. So as far as the adverse drug reaction is considered, the WHO definition of adverse drug reaction is any noxious change, okay, जो आपको चाहिए नहीं है, which is suspected to be due to a drug. Now कोई noxious change आपको पेशेंट में मिलता है after starting the drug, but it is your suspicion कि ये drug की वजह से हुआ है, ये yet you are not sure, still we can see the label it as an adverse drug reaction. What is the next part of definition? It occurs at a doses normally used in a man. Okay, आपने जो नॉर्मल डोज था, फॉर एग्जांपल 650 मिलीग्राम पैरासिटामोल 3 टाइम्स 4 टाइम्स डेली, वही डोज दिया है और उसी डोज पे आपको कुछ नॉक्सियस चेंज या अनडिजायरेबल इफेक्ट्स मिलता है. इट रिक्वायर्स अ ट्रीटमेंट. वो एडवर्स ड्रग इफेक्ट के लिए आपको कोई ट्रीटमेंट देनी पड़ती है, और डिक्रीज इन द डोज, मे बी हाउ टू डिक्रीज द डोज, और it just indicates the caution in the future use of a same drug. So all these aspects, they have been covered into the adverse drug reaction. At the same time, there is a similar terminology, adverse drug event. Okay, so we'll see what is the difference between these two terminology. any untoward medical occurrence that may present during treatment with a medicine. Okay, आपने ड्रग दिया या मेडिसिन दिया और पेशेंट में कुछ भी अनटूवर्ड मेडिकल ऑकरेंस होता है, but which does not necessarily have causal relationship with the treatment. लेकिन जरूरी नहीं कि उसका ड्रग के साथ आपको एसोसिएशन या आपको रिलेशनशिप मिले. फॉर एग्जाम्पल आपने पैरासिटामोल दिए तो आपको उसके नॉन एडवर्स इफेक्ट पता है, but at the same time the patient suffered from hip fracture. Now this is something unrelated from the available literature or the references. We cannot say that the hip fracture is related to the paracetamol, so we can label that hip fracture as an adverse drug event. Okay, but at the same time if the patient is having some heartburn, okay, or nauseating feeling, that may be because of paracetamol, so we can label that as an adverse drug reaction. So we can say all adverse drug reactions are adverse events, but not all adverse events are adverse drug reaction. Now coming to the next aspect, that is a risk benefit ratio. Okay, so whenever a drug is given, a risk is taken, but why we are taking that risk? For the therapeutic benefit. Okay, this is very much obvious thing, but this is again differs from the indication as well as the patient perspective. If you are giving the anti-cancer drug for treating cancer, even a risk of bone marrow suppression or aplastic anemia is justifiable, because at that time you have to save the life of the patient or you have to increase the survival of the patient. But when you are treating a common cold and you are giving an antihistaminic, even a risk of sedation is unacceptable. So this is how the risk benefit ratio you have to always look for giving any drug. Benefit should be more, risk should be less. Now coming to the various types of adverse drug reaction. There are type A to F, that is the 6 types, but out of which type A and B, they are more commonly seen in the clinical practice. What is type A? A stand for augmented. Means these are expected undesirable ADR. Okay? Obviously ADR are undesirable, but these are expected. For example, if we are giving sulfonylurea for type 2 diabetes mellitus and it is lowering down the blood sugar level, but if it low down than normal, then hypoglycemia will occur. If we are giving, okay, so then second is a type B. The B stand for bizarre. These are unexpected, undesirable ADR. For example, allergic reactions caused by the penicillins. Now, what is the difference between type A and B? Type A are predictable, they are more common and dose related. While type B, like allergic hypersensitivity reaction or idiosyncratic reaction, they are unpredictable, they are less common, and they are not related to the dose. Okay, so in practice, A and B type of ADR are more commonly observed. Type C is a chronic ADR. C stand for chronic. Peptic ulcer caused by chronic use of NSAID. Type D is a delayed effect ADR. For example, teratogenicity by thalidomide. We are going to see in the coming slides about the thalidomide. But obviously, you know, teratogenicity is when we are giving the drug in a pregnant female, the defects or congenital problems which are observed in the fetus. So this come under delayed effect ADR. Both देर बाद होता है. टाइप ई इज एंड ऑफ ट्रीटमेंट एडीआर. आपने ड्रग ट्रीटमेंट स्टॉप कर दिया, उसके बाद एडीआर हुआ, एडवर्स ड्रग रिएक्शन हुआ. फॉर एग्जांपल, withdrawal response to morphine. You have given an opioid analgesic for some visceral pain or for some severe cancer type of pain, and if you suddenly stop the morphine, the patient land up into the withdrawal symptoms. Okay, that is end of treatment ADR. And type F is a failure of treatment ADR. Okay, so आपने बोला कि मैंने जनरल एनेस्थेटिक्स दिया, ऑब्वियसली फॉर जनरल एनेस्थेशिया पर्पज, लेकिन अगर पेशेंट को एनेस्थेशिया डेवलप ही नहीं हुआ, सो दैट इज अ फेलियर ऑफ इफिकेसी or failure of treatment, and that comes into the ADR, that is a type F. Now, why this adverse drug reaction reporting is necessary? आप बोलते हो कि ऑलरेडी क्लिनिकल ट्रायल्स हो चुके हैं, फिर एडवर्स ड्रग रिएक्शन पता हमको पता है, फिर क्यों जरूरी है? तो if you look back into the history, the thalidomide, when it was given to the pregnant females in a various hospitals of London in a period between 1959 to 1961, more than 10,000 cases of phocomelia have been observed. Okay, and you can see in these pictures that the phocomelia means limbs are not developed, whether it is upper limb, lower limb, they are not fully developed, which is a very severe effect. and this leads to withdrawal of the drug from the market. Nowadays, thalidomide has again reintroduced into the market for some another indication like for erythema nodosum, leprosum, as well as anti-angiogenesis in certain cancer. But still, now we know that this adverse effect can happen with thalidomide. So now we are very observant. We are looking for the pharmacovigilance here. These are the various adverse effects which you can came across in a clinical practice. That is a gum hypertrophy, which is observed with phenytoin or cyclosporine, cleft palate and cleft lip, which is observed with methotrexate carbamazepine, then spina bifida, which is observed with valproate. Then these are the certain drugs and common ADR observed with them. For example, ampicillin can cause diarrhea, chloroquine can cause nausea, vomiting, cefixime can cause diarrhea and stool changes. So what is the important that whenever you observe certain another symptom which is not present at the time of the admission, then you suddenly not jump onto the another diagnosis. You may look for that whatever drugs we have prescribed, it may be there that drugs have caused this adverse effect. Okay, so that's why you should be very observant and you should know the literature or references ki is drug की वजह से क्या adverse drug reaction हो सकते हैं. Now some drugs some side effects are already reported but some are not reported. Similarly, these are the like sedation अगर होता है तो कौन से ड्रग की वजह से होता है, ट्रिमर्स लाइक थियोफाइलिन, लिथियम. सो यू शुड बी ऑब्जर्वेंट कि पेशेंट में जो साइड इफेक्ट हो रहे हैं उसके हिसाब से आप आपका एक सस्पिशन रेस कर सकते हैं कि अवेलेबल ट्रीटमेंट में से किस ड्रग की वजह से हुआ है, उसको आप रिपोर्ट भी कर सकते हैं एंड देन यू कैन मैनेज दैट एडीआर आल्सो. ओके, so why ADR reporting is necessary or the need of pharmacovigilance? That ADR are among the leading causes of death in many countries. Okay, this is a very shocking truth that ADRs stand on a fourth or fifth number of leading cause of a death, especially in the developed country. In India also, ADR account for 5 to 10% of all hospital admissions. And this is a very neglected field whenever we look for the certain diagnostic things. We always jump on our diagnosis. Okay, but you should see that which drugs are prescribed और किसी drug की वजह से हो सकता है क्या. For example, Steven Johnson syndrome or anaphylactic shock or certain other things are there which are very much obvious and that we should look for the drugs as a causative agent for that. So this ADR constitute a significant economic burden on the patient and the government. Then as I already told you that in clinical trials we already explore the safety aspect. But what is the difference between clinical trial and clinical practice? That in clinical trial, the drugs have been tried only in thousands of patients, while in clinical practice, we are giving the drug in millions of patients. In clinical trials, hardly we are giving the drug for certain weeks, while in clinical practice, we are giving for years. The pregnant, children, elderly, they are excluded in clinical trials, while in clinical practice, we are giving the drugs to all the population. Concomitant medication and illnesses they are avoided. आपने देखा होगा एक्सक्लूजन क्राइटेरिया में हम मोस्ट ऑफ द पेशेंट्स को एक्सक्लूड कर देते, और क्लिनिकल प्रैक्टिस में यू कैन नॉट डू लाइक दिस कि आप मेरे सिर्फ डायबिटीज के लिए ट्रीट करूंगा, मैं हाइपरटेंशन को ट्रीट नहीं करूंगा. You have to simultaneously look for the other concomitant conditions as well as the medication. Dose is fixed in clinical trial while it is a variable. So these are the certain things that whenever a drug is coming to the market, especially what we call phase 4 or even after that, then pharmacovigilance or role of safety, it is a continuous process and it does not end with merely with clinical trials. That's why there is a need of pharmacovigilance or ADR reporting. So road to pharmacovigilance goes to the safety first. This is a definition of pharmacovigilance. It is a science and activities dealing with detection, assessment, अंडरस्टैंडिंग एंड प्रिवेंशन, दैट इज कॉल्ड शॉर्ट फॉर्म डॉप, DAUP. आप डिटेक्ट करोगे एडवर्स इफेक्ट को, फिर आप असेस करोगे कि वो पर्टिकुलरली ड्रग के साथ है क्या, रिलेट करोगे उसको, अंडरस्टैंड करोगे व्हाई दिस एडवर्स इफेक्ट माइट हैव हैपन इन दिस पेशेंट एंड यू विल ट्राई टू प्रिवेंट for the second time or in the future in the same patient as well as in another patient. So this is pharmacovigilance is a science which is dealing with the adverse effect. Then coming to the pharmacovigilance program of India, this is a structure of that program. You can see that Central Drug Standard Control Organization, that is a CDSCO, it is a headquarter. for looking this PVPI, that is the Pharmacovigilance Program of India. While National Pharmacovigilance Coordinating Center, it is located in Indian Pharmacopoeia Commission, Ghaziabad, what we call is a IPC. Okay, and there are various ADR monitoring center which are working under this IPC Ghaziabad, and these ADR monitoring centers are located in various NMC approved medical colleges and hospital, various private hospital, or as well as in the pharma industry. So all the data, it has to be actually reported to the ADR monitoring center, what we call as AMC, and AMC, after causality assessment or the due analysis, it forward the data to the IPC Ghaziabad, and after that the IPC Ghaziabad forward the data to the World Center, that is a located in the Sweden, Uppsala Monitoring Center. Now, what are the activities involved in pharmacovigilance? These are the पोस्ट मार्केटिंग सर्वेलेंस. एक बार मार्केट में चला गया ड्रग, उसके बाद आप उसको कंटिन्यूअसली सर्वेलेंस कर रहे हो, सच एज वॉलंटरी रिपोर्टिंग ऑफ डॉक्टर्स, प्रिस्क्रिप्शन इवेंट मॉनिटरिंग. देन सेकंड एक्टिविटी इज डिसेमिनेशन ऑफ एडीआर डाटा. आपके पास जो भी डाटा मिला है, इट इज योर ड्यूटी टू डिसेमिनेट टू द वेरियस स्टेक होल्डर्स लाइक फिजिशियन थ्रू द ड्रग अलर्ट, okay, through the medical letter or through the advisories. And third thing which is involved is the changes in the labeling of medicine, indicating restriction in use or statutory warning or precautions or even withdrawal of a drug from the market. You can see these are the drug safety alerts which are generated through this Pharmacovigilance Program of India. Just for example, cefpodoxime can cause this DRESS syndrome, like drug reaction with eosinophilia. Clarithromycin can cause this burning sensation. तो ऐसे ड्रग सेफ्टी अलर्ट पीवीपीआई अपने एएमसीज, दैट इज एडीआर मॉनिटरिंग सेंटर को भेजते रहता है, एंड it is a duty of AMC to forward it to the various healthcare professionals. There are the various drugs which are banned in the India, and thanks to this PVPI program, because of which continuous monitoring and observing the adverse effect. To name a few drugs: fenfluramine, dexplenfluramine, rofecoxib, valdecloxib, rosiglitazone, okay, then gatifloxacin, tegaserod. These all drugs, they are banned as a single drug preparations or certain drugs in combination, and it is because of this continuous pharmacovigilance program. Now I am going to show you how the ADR reporting form look. Yes. So this is how the ADR reporting forms it looks. Suspected adverse drug reaction reporting form for voluntary reporting of ADR by healthcare professionals. Until now, it is not mandatory, but it is voluntary reporting, and that's why it is becomes a moral and ethical duty of healthcare professionals as well as others involved. Okay, like patient, pharmacists, dentists. So there are four important things which we have to fill. First is a patient information. Here we have to write the patient initials, not a full name, only the initials, in order to not disclose the identity. Then age of the patient, gender, male, female, and the weight. The second column is a suspected adverse reaction. Okay, event or reaction started. For example, a patient is suffering from diarrhea. किस दिन से उसको डायरिया स्टार्ट हुआ आफ्टर गिविंग द ड्रग. इवेंट और रिएक्शन स्टॉप डेट. अगर डायरिया स्टॉप हो गया तो उसका आप स्टॉप डेट आप लिख सकते हो. अगर स्टॉप नहीं हुआ है अब तक, जब तक आपके पास रिपोर्ट आ रहा है, यू कैन कीप दैट फील्ड ब्लैंक. Then describe the event or reaction management with details. Here in just in a appropriate words, in a 4 or 5 lines, a patient has been given this and this drug, for example ampicillin. After ampicillin, the patient suffered from diarrhea. So in a very limited but yet scientific words, you have to describe that reaction. Then third column which is important in this form is a suspected medications. तो पेशेंट को जो मेडिकेशंस थे उसमें से आप कौन से मेडिकेशन की वजह से सस्पेक्ट करते हो कि ये एडवर्स ड्रग रिएक्शन है. जितना सस्पिशन ज्यादा, उसका नंबर ज्यादा रहेगा. सपोज आप ये ठीक से देख नहीं मुझे नहीं कर पा रहे हो कि एनालिसिस की किस ड्रग की वजह से हुआ है, तो आप 1 2 3 4 4 ड्रग भी यहाँ पे लिख सकते हो. ओके, क्या लिखना है आपको? नेम ऑफ द ड्रग, मैन्युफैक्चरर, बैच नंबर, एक्सपायरी डेट. ऑल दीज आर नॉट मैंडेटरी. मैन्युफैक्चरर, बैच नंबर एंड एक्सपायरी. देन डोज क्या दिया था, रूट कौन सा था, फ्रीक्वेंसी क्या थी, थेरेपी आपने कब स्टार्ट की, कब स्टॉप की, अगर स्टॉप किए तो किस इंडिकेशन के लिए ड्रग दिया था. एंड कॉजेलिटी असेसमेंट शुड बी लेफ्ट ब्लैंक बाय द रिपोर्टर. इट मे बी रेसिडेंट, इट मे बी नर्स, जो भी रिपोर्ट कर रहा है, कॉजलिटी असेसमेंट आपको लिखने की जरूरत नहीं है. इट इज अ ड्यूटी ऑफ एडीआर मॉनिटरिंग सेंटर, स्पेशली द एक्सपर्ट फार्माकोलॉजिस्ट फ्रॉम द दिस एएमसी, कि वो कॉजलिटी असेसमेंट उसको ये करेंगे. उसके 4 ग्रेड होते हैं, सर्टन, प्रोबेबल, पॉसिबल एंड अनसर्टन. सो इट विल कि हम उसकी ग्रेडिंग को करते हैं कि किस तरह से वो कितना रिलेट कर रहा है ड्रग के साथ, ये एडवर्स ड्रग रिएक्शन. देयर आर वेरियस स्केल्स. ओके, due to the paucity of time I'm not going into the detail of that. Then एक्शन टेकन आफ्टर रिएक्शन. रिएक्शन होने के बाद आपने क्या एक्शन लिया? ड्रग को विड्रॉ किया, आपने स्टॉप कर दिया, आपने डोज और इंक्रीज किया जो कि बहुत रेयर है, डोज रिड्यूस किया आपने, डोज नॉट चेंज, जैसे था वैसे ही रखा, नॉट एप्लीकेबल और अननोन, जो भी एप्लीकेबल है उसको आपको टिक करना है. Next column is reaction reappeared after reintroduction of suspected medication, and in pharmacological language we call it as a re-challenge. कि आपने कंफर्म करने के लिए कि ड्रग के वजह से ही एडीआर हुआ था क्या, वापस से सेकंड टाइम ड्रग दिया, बट इट कैन बी रिस्की एट टाइम्स. दैट्स व्हाई all the monitoring as well as ICU vital function monitoring capacity should be there. Then आपको concomitant medications कुछ दिए गए थे क्या? Sorry. So there are the column of reporter details. I'm not able to take it down. I will explain you in the example. Now again coming back to our presentation. So which ADR need to be reported? All serious, non-serious, known, unknown, all ADRs need to be reported, whether they are due to the drug, whether they are due to the vaccine, whether due to the medical devices, what we call as a material vigilance, whether due to the blood products. Who can report? Doctor, dentist, pharmacist, patient, nurse, all can report. Where to report? Send field ADR reporting form directly to the National Coordinating Center or to the nearest ADR monitoring center. There is a helpline or toll-free number 1800-180-3024, or you can fill the ADR form and mail it to the PVPI at ipcindia.net. Then there is a ADR PVPI mobile app which you can download from Play Stores. What happens to the submitted information? That I have already told you, that the information is forwarded to the national center through the VisiFlow software, which is given by this Pharmacovigilance Program of India and national international center by the Sweden. And after looking all the data, the signal review panel will review the data and suggest any interventions if they are required. For example, any warning or precautions or ban of the drug, okay, or recall of any batch. Very important, the submitted ADR report does not have any legal implication on the report. बहुत बार डॉक्टर्स में, रेसिडेंट्स में, नर्स में ऐसा लगता है कि अगर मैं ये रिपोर्ट करूंगी तो मुझ पे कुछ एक्शन हो सकता है, नॉट एट द इंस्टीट्यूट लेवल और मे बी एट अ लीगल लेवल. सो आई मेक इट क्लियर दैट this will not stand in a court of law as a proof against you. So there is a no legal implication on the reporter for the submitted ADR reported form. All the information is held in strict confidentiality only with program authorities. This is one example just to explain you how you can fill the ADR reporting form. So I am reading it. Madan Lal, a 65-year-old male patient, which is admitted to the hospital on 12th of September with chief complaints of pain in upper abdomen and nausea since last 5 days. Last 5 days से उसको pain in abdomen हो रहा है और nausea हो रहा है. On physical examination, he had yellowish discoloration of a palm, conjunctiva, and nail bed, and his weight was 72 kg. He had few episodes of psychotic attacks for which he was on chlorpromazine therapy since last 4 weeks. Antipsychotic दे रहे 4 weeks से. On inquiry, he was taking the tablet Largactil, which is a brand name of chlorpromazine, 100 milligram 4 tablets at bedtime. रोज 4 tablet ले रहा है एक ही time पे. He was also taking tablet diclofenac 50 milligram twice daily as a self medication for abdominal pain for 3 days before admitting to the hospital. He was investigated on the day of admission. 12 तारीख को जो वो admit होने के लिए आया तब उसके investigation किए LFT. All alkaline phosphatase was very raised, that is 180 units. Alanine transaminase, that is SGOT, is a 205, which is again raised. and total bilirubin was 5 milligram per deciliter. So it clearly indicates that patient is suffering from hepatotoxicity, and this is because of the chlorpromazine. Again, we have to analyze, but just as this is an example for you, I'm telling you. On admission, chlorpromazine and diclofenac therapy was stopped. Okay. After 7 days of stopping the medication, the intensity of pain decreased. जो abdominal pain हो रहा था वो, and patient was reinvestigated for above parameters. So you can see alkaline phosphatase, which was 180, it has came down to the 110. Alanine transaminase, which was 205, it has came down to the 98, and total bilirubin came down to the 1.8 from 5 milligram. So patient is recovering, but still the parameters are not fully normal. So you can say patient is recovering and not recovered. This is form filling के लिए डाटा दिया है. टैबलेट क्लोरप्रोमेजिन, ब्रांड नेम लार्गेक्टिल, उसका बैच नंबर, उसका मैन्युफैक्चरर नंबर. So you can see how to fill this ADR reporting form. So these are the 4 important column: patient information, suspected adverse reaction, suspected medication, and reporter detail. तो हम देखेंगे पेशेंट इंफॉर्मेशन में रिपोर्ट टाइप इनिशियल, क्योंकि पहली बार आया है. पेशेंट इनिशियल मदन लाल नहीं लिखा, सिर्फ एमएल लिखा. एज 65 ईयर्स, फिर उसका मेल, weight उसका 72 kg. This all you need to fill. Second, and IPD or OPD number that should be put in order to trace of patient or for further inquiry. Suspected adverse reaction एक वीक से 7th of September को हुआ. Then a patient was taking chlorpromazine. In this he developed nausea, pain, examination revealed yellowish discoloration. आपने सब डिस्क्राइब कर दिया. उसके बाद सस्पेक्टेड मेडिकेशंस में आपने टैबलेट क्लोरोप्रोमेजिन, उसका मैन्युफैक्चरर, बैच नंबर, एक्सपायरी डेट लिखा, डोज लिखा, उसका रूट लिखा, ओरल रूट 400 mg, उसकी फ्रीक्वेंसी लिखी, ओडी, थेरेपी कब स्टार्ट की थी 12 अगस्त को, थेरेपी 12 सितंबर को खत्म हुई या हमने स्टॉप कर दी. साइकोसिस के लिए दिया था, आपने एक्शन क्या ली, आपने ड्रग विड्रॉ कर दिया. जैसे एडमिट होने के लिए पेशेंट आया, रिएक्शन रीअपियर्ड आफ्टर रीइंट्रोडक्शन, आपने वापस देके देखा क्या, नहीं, आपने नहीं किया, तो जस्ट कीप इट ब्लैंक. concomitant medical products, yes, we have given a diclofenac. पेशेंट ने खुद ऐसे लिया है, सेल्फ मेडिकेशन, नॉट प्रिस्क्राइब बाय फिजिशियन. 50 मिलीग्राम ओरल बीडी दिया गया. 3 दिन पहले लिया था उसने, 9 सितंबर को, और 12 सितंबर को एडमिट होने के लिए आया था पेन इन एब्डोमेन के लिए. सो दिस इज हाउ यू कैन डिस्क्राइब द कॉन्कोमिटेंट. देन रिलेवेंट टेस्ट और लैबोरेटरी डाटा, 12 सितंबर को एडमिट के दिन का डाटा और 7 डेज के बाद रिपीट किया, वो डाटा आपको यहाँ पे लिखना है. दिस AMC रिपोर्ट नंबर, इट शुड नॉट बी फील्ड बाय द reporter. It is a duty of AMC. Worldwide unique number is generated after we fill the form into the software, that is Visiplo. रिलेवेंट मेडिकल हिस्ट्री अगर हो तो ये रिएक्शन सीरियस है या नहीं, यस इट इज सीरियस. व्हाई, इसमें से अगर कोई पैरामीटर सेटिस्फाई हो रहे हैं, यस हॉस्पिटलाइजेशन करना पड़ा पेशेंट को, तो हमारा ये पैरामीटर सेटिस्फाई हो रहा है, दैट्स व्हाई दिस इज अ सीरियस रिएक्शन. ओके, आउटकम क्या है, पेशेंट इज रिकवरिंग, अभी तक फुल्ली रिकवर नहीं हुआ है. एडिशनल इंफॉर्मेशन इफ यू वांट टू पुट एनी, so patient is referred to the psychiatrist for revised drug therapy for psychosis. As all of you are now a past MBBS, so we know that atypical antipsychotic should be preferred rather than the typical antipsychotic like chlorpromazine. Reporter details, तो जो कोई रिपोर्टर है वो अपनी डिटेल्स डाल सकता है. फॉर एग्जांपल डॉक्टर ABC फ्रॉम डिपार्टमेंट ऑफ मेडिसिन, पिन कोड, टेलीफोन नंबर, email ID, occupation, and the date of this report and the signature. Okay, so these are the mandatory fields in the ADR form: patient initials, age at the onset of reaction, date of onset of reaction, reaction term, suspected medication, reporter information, and date of this report. So thank you for your patience listening. Your 5 minutes can help us to ensure the safer medication. Thank you. Over to you, Dr. Singh, sir.
Yeah, thank you, Dr. Tushar, for that elaborative explanation about adverse drug reactions and its timely reporting to the regulatory authorities. If anybody has some questions in relation to the presentation which has been made recently, you can ask or you can put in the chat box also. I would just like to, in the meantime, if somebody is writing, any question, just keep on seeing the chat box also. It is very important to report, right? If you asked me to consolidate the entire message which has been given in this presentation is that the first aim of medicine or the first principle of medicine is first do no harm. We are very much interested regarding the safe use of the drug. And in order to make the drugs even more safe, it is the responsibility of the physician to report any adverse effect, because if we get reluctant in terms of reporting, certain adverse effects which are there associated with the drug might not come in record, and patient might keep on suffering because of that. And this will ultimately lead to the failure of the very essence of medicine, that is to do no harm first. So it is very important message for all the doctors who are who are there as participants, that in order to make the use of drugs safe, it is very important for us to report. And finally, as Dr. Tushar has very rightly said, you should not be worried about one thing, that if I'll report, this thing will come back onto me only, that why I have given this medicine, and because I have given this medicine, this problem has come. This does not have any legal implication, but important is